Hello, everyone, and happy holidays. Be safe. Well, that's why we're bringing this topic on how physiotherapy can help you with your joint and bone health. We have Kehinde Adeyo. She is joining me all the way from Nigeria. I am super excited. She's not only a physiotherapist, but also an acupuncturist. Welcome and namaste so much. Thank you so much.
Thank you.
Namaste, Kehinde.
Thank you for your warm welcome. I appreciate it.
Absolutely. So, since you are both physiotherapists and acupuncturists, I think let's just understand what is it from a preventive point of view. Not that someone is now 70 years old and they have bone issues, but when we are younger, what is it that we can do from physiotherapy? And if you'd like to talk also about acupuncture for bone health.
Sure. So I guess it's with physiotherapy, there are different specialities, but the guys that deal with bone and joint health are called orthopedic or musculoskeletal physiotherapists. And the way in which they can help bone and joint health is predominantly through the use of exercise and movement therapy. We know that exercise helps to improve the strength of muscles, joints, and ligaments. Now, because these things surround the joint, if you get them to be a lot stronger, what they do is they basically brace around the joint and create an element of support, stability, and protection. This can then have a side-on effect on the bone itself because the bone develops greater density, which then makes it stronger and durable for the activities you'll be utilizing it on a daily basis. So because of the effects of exercise on all of this, it can then also help to reduce the risk of osteoporosis or brittle bones. Exercise can then also have a knock-on effect in terms of improving coordination, balance, which then can help to reduce the risk of falls. Now, I know we talked about preventative measures. Preventative measures aren't just for the young people, it's also for elderly people as well. We know that elderly people tend to get a lot of ill health after falls. So if you can strengthen the bones and joints effectively prior, they're less likely to have those risk factors later on. And then that can then have a greater knock-on effect in that if the person is strong and able, they're not going to rely on an external person to help them carry out the activities of daily living. And that does a whole lot for mental health and quality of life overall. I think, like you mentioned as well, exercise isn't just for the elderly, it's also for the young people. Unfortunately, we tend to break the laws of nature daily by carrying out a lot of sedentary activity, sitting down by our desk, being stuck in traffic on our way to and from work, or sitting down and watching TV daily. These in of themselves they're not bad things, but when we do them repetitively, it can create a state of stagnation within our system, which makes us more prone to chronic health-related diseases, things like type 2 diabetes, heart disease, high blood pressure, so on and so forth. So if you can start to get into the habit of exercising from a young age, that can then become your lifestyle as you get into adulthood, and it can prevent all those other negative side effects of sedentary living overall.
That makes sense. Now, you mentioned exercise. It has a lot of data, but there's so many different type of exercises, right? So I think what we want to understand is the two. If we younger people, what type of exercise they should do for preventive measure. That's number one, and number two, for the elderly who have not exercised because of the sedentary lifestyle, right? What can they do? And now they're stuck because they haven't done what they were supposed to do 30 years back. And now they're in this, 65 above or 70s. What can they do? So that's kind of, if you just shift that and help us.
Sure, of course. So starting with the younger population, as I mentioned earlier, a lot of us tend to find ourselves in sedentary situations. So this isn't really an exercise per se, but it's a great habit to get into. I always advise my clients that if you have a desk-based role, or you know that you're going to be sat down for long periods, set an alarm on your phone on an hourly basis. So every time that alarm goes up, use it as an opportunity to get away from your chair, move about, go for a coffee break, anything that gets you moving away from that sedentary position will go a long way. Another really good form of exercise, which I feel like a lot of people really miss out, but it's very, very simple and effective, is deep breathing exercises. We know that breathing helps to modulate the nervous system. It helps to calm it down, and it helps your body to become better at releasing its own natural painkillers and feel-good chemicals. So getting into the habit of encouraging correct breathing can go a long way. And one of the best ways I would say to try to get that going is placing your hands on your stomach. And sometimes I tell my clients, close your eyes so that you can become more aware of how you're breathing. So you place your hands on your stomach, and as you take a deep breath in, you want to feel your stomach balloon out and your rib cage balloon out to the side, okay? And then as you breathe out, your belly button should sink back in towards your spine to let out all the waste products from our system. Unfortunately, in this day and age, people carry out a paradoxical form of breathing. They carry out shallow breathing from the chest, which actually reduces the amount of oxygen you can get into your system. And that's no good for you if you're trying to get into an exercise routine to help to improve your joint or bone health. So that's definitely another thing I would recommend. In terms of other exercises for younger people, in all honesty, I always say, don't really matter what kind of exercise it is you're getting into, just move. That's all your body is asking you for. So if you like dancing, get into dancing, because once you have something that you like, you're going to be more motivated to actually use that as a form of exercise and therapy for yourself. So if dancing is your way to go for it. If you like hiking, go on regular hikes on a daily basis. If it's walking, if it's jogging, it doesn't matter. Just utilize that to help your body get into a movement pattern. And then I always recommend having an accountability buddy. That goes a long way, because you will have days and moments where you just don't feel like exercising, and that's fine. But if you have a partner who's like, oh, come on, we can do this today, that will give you that extra little boost to decide, all right, let's go for that walk. And by the time you've done your 30 minutes, you feel so much better in yourself because you've done exactly what it is that your body needs. So those are the kind of things I would recommend for the younger population. You did mention about the older population as well. So if you're a lot older and you've not really built the lifestyle of exercise into your routine, I would always advise that you seek the advice of a professional just to help you within the first couple of weeks or months so that you can build that routine. Because what we don't want is for you to go from 0% exercise straight to 100%, because then you're going to increase your risk of injury. We want to avoid that as much as possible. So exercises that the elderly can start, we always advise functional-based exercises, things that would help that individual to be able to carry out their activities of daily living with ease. So simple things like being sat in front of the TV, when the alarm goes off after the hour, sit to stand. So sitting and standing, doing 10 repetitions, maybe every 1 or 2 hours, just simple little things like that can help the knee joints to become better at tolerating weight and load. Okay, so once your body becomes better at doing that using your own body weight, you can then progress to adding external weights. We know that there's tons of evidence that tells us that the best way to increase bone strength and joint health is utilizing weight, either your body weight or external weight. So once you've gotten past that initial resistance from your body because it's not used to it, you want to make sure that you're continuously progressing so that your body can be better able to adapt to its environment with ease all the time.
Beautiful. So now, acupuncturist, I have to ask you this question on how can acupuncture combined with the physiotherapy that you are doing help us, acupuncture for bone health. What does that entail? Like, should we do preventive again, or if someone is older, should they go for regular acupuncture sessions? Plus, you talked about talking to some kind of a exercise specialist or someone who can help them from a professional level. So
excellent. So that's a really good question. I have always believed that physiotherapy and acupuncture work hand in hand together. It's like a beautiful couple that just work well together. When we think about the aim of physiotherapy, it's to kind of help to restore function, no matter what it is that got you to a loss of function in the first place. Acupuncture helps to encourage the body's natural healing system. It helps to boost it up naturally. So if we think about trying to get someone to, either from a preventative point of view, or if they already have an injury, if we want to encourage healing, acupuncture can go hand in hand with physiotherapy, because you're going to get the body to help to release its own natural painkillers and feel good chemicals through the use of acupuncture. That's going to motivate the individual to want to exercise, because now they'll no longer be in pain or discomfort, or their joints feel looser and more able. So the two can work really well together depending on what the condition is overall. Yeah.
All right. Is this small exercise that you want to show us, a simple breathing or any, I don't know, we're sitting like that, something that we can do a small
Yeah,
step?
sure.
Yeah.
Sure. So the one thing I think I would recommend is, okay, so a lot of people come back home from work and then they have their dinner and then they sit in front of the TV. Literally, what I would say is every hour, set that alarm on your phone, and all you want to do is cross your hands across your chest, push your feet down into the floor, and just carry out a couple of sit to stands. So doing about 10 repetitions, so it's quite similar to a squat, I guess you could say. And what you're doing here is you're working on the strength of your lower limbs. So by pushing up, you're utilizing your leg muscles to help to brace and support the joints. You can imagine if you did, let's say you spent 3 hours in front of the TV and you did 20 of those every hour, that's 60 every single day. It sounds little, but it all adds up over a period of time. It's like climbing stairs. You take the first step, it may feel hard initially, but as you keep going, it'll start to get easier and easier, and then you can start adding other progressions. So instead of just doing the sit to stand independently, you can add a bottle of water, use that as your external weight, or 2 bottles of water, and after you're done, you have your refreshment to help you rehydrate after. Win-win situation. So I feel like exercise doesn't necessarily have to be, oh yeah, let's go to the gym or let's run a marathon. You can do very simple functional things at home in front of your TV to help to encourage that movement therapy that our body generally seeks out on a daily basis.
Thank you so much. This is a quick 10-minute session that we wanted to bring how physiotherapy combined with acupuncture can help strengthen our bones, which is so important as all of us age, and the issue is, with the elderly fall, right? The fall is number one issue, that they're so scared because their bones become so brittle. You don't want to do that. You need to figure it out when we are all younger rather than figure it out when we get there, getting over there, get it over there.
I completely agree. And as I mentioned before, the earlier you start, the better, because it then develops into a kind of lifestyle habit that you will feel off if you actually miss your session of exercise, because you're so used to doing it on a daily basis. And let's not also forget the other benefits of exercises that aren't just related to bone and joint health. You've got the fact that exercise helps you to maintain a healthy weight, which will also then have a knock-on effect on the joints because it's not heavily loaded. But then it also helps you to, it improves mood, it improves sleep patterns. And another really good benefit of exercise in the long run is it encourages discipline. No one likes waking up at 5 a.m. in the morning to exercise, but if you do it over and over and over again, you develop a sense of discipline that then you can translate into other parts and other aspects of your life. So it's really is a win-win situation overall.
Thank you so much, Kehinde, for joining us from Nigeria. I'm really very touched, and all your wisdom for all of us. That's what we are trying to do every single day. Help people to incorporate a holistic lifestyle, make some modifications. Even if it's a small modification, try to do that on a daily basis. Try to do that with that.
And it all adds up, doesn't it?
Absolutely. I had to do it a few years back, and now I can't live without it. So that's what I'm trying. I want to talk. Yeah.
Perfect. I always say that everything is everything is addictive. So it's either you're spiraling up positively or spiraling down negatively. Exercise would be a good way of spiraling up positively in that sense.
I love that. I love that. The way you said exercise. Positivity. I love that. Thank you so much, everyone else. Happy holidays. Merry Christmas. It's Christmas Eve tomorrow. We will be taking a break during the holidays. So yes, and we will see you back in the new year. Thank you. Bye-bye.
Thank you.